I'm a healthcare assistant.
I'm a rehabilitation assistant.
I work as a nursing assistant.
I'm a healthcare supporter.
I'm a speech and language therapy assistant.
I'm a senior imaging assistant here in radiology. So my main role in the ultrasound rooms and in most of the rooms is to chaperone the patient, make sure they're comfortable and just look after them, make sure they have a pleasant experience here in radiology. We are part of the journey that they may be on. Most people coming into hospital environment will have to come through this department in some way. We're part of a jigsaw and part of their journey.
When I'm in the community setting, I have a sort of caseload of Parkinson's patients. When I'm here, I might be writing out special menus for people because they have to have a specific texture of food because their swallowing's not optimal. Also work on the stroke ward sometimes, supporting there, doing some therapy for people. They might have aphasia, which means it's sort of difficulty sort of getting their words out. They might have dysarthria, which means they might have, if you like, slurring or imprecise sounds post-stroke. We do sort of rehab and lots of note writing as well.
My role entails dealing with patients from the start, mainly of their journey into the NHS. I was working, dealing with the NHS, working for a trade union. And prior to that, I was a qualified nurse, but I always said that once I left my previous employer that I would come back and return back into the NHS.
Why was it that you decided to come back into the NHS?
Because I still feel, even at my age, that I have something to give to the NHS, I enjoy dealing with people on a daily basis. If you enjoy dealing with people, if you enjoy working hard but going home at the end of the day feeling like you've really achieved something, then this role is for you.
The hospital is the last place you want to be for anyone as a patient, but if they get cured and they go home and they appreciate what we do, we are happy as well, because then we know that the job we are doing is making a difference in the patient's life. And once you finish your work and you go home and you think about it, what you have done that day, and I'm 100% sure that you will feel that, yes, there's something you have done and you have made someone happy.
I work on F8. My job is helping people like patients to make sure they're well, they're safe, assist nurses, tell any concern, and also it's important to build trust with patients, make them feel safe, because most of them are vulnerable.
So it's all about keeping people as independent as possible, or returning home in the same state that they basically came in as much as possible, getting them back to how they were before they came into hospital.